Hello, everyone. It's funny. I purposefully waited like 30 seconds to see if the tornado sirens are going to start. And I thought, oh, maybe not today. Now I can hear them as soon as I push go live. Hi, everyone. My name is Stacy Nell. I am the executive director of the Kansas African American Affairs Commission, and this is our weekly Lunch and Learn series. Today, I am thrilled to be joined by Sapphire Garcia Lies of the Kansas Birth Justice Society. Hello, welcome.
Thank you.
Yay! It's a lunch and learn. So the first question I always ask is, "What are you having for lunch?"
I am having a energy drink. I counsel people on nutrition and pregnancy, so just don't do what I do. But we need energy. We have systems to change.
This is very true. I mean, there are probably a nutritionist would probably have some ideas about that, but that's neither here nor there. I do want to take an opportunity and read your bio to let people know a little bit about you and where you are coming from and why you are the correct person for me to have on to talk about these issues. So today, my guest is Sapphire Garcia Lies. She began her journey as an activist and community advocate a couple of months after her daughter Ella passed away due to medical negligence. In the years since Ella's death, Sapphire has fought for racial equality and maternal and infant health by empowering parents and calling for accountability within medical systems. In 2020, Sapphire founded the Wichita Birth Justice Society with the goal of eliminating Wichita's racial disparities in maternal and infant health. She currently serves as president and sits on the board of directors of the Kansas Birth Justice Society. And we can even talk about the name change. I mean, you mentioned that to me at one point. I want to get back to that. She's also a part of the neighborhood doula advocates team, which is making history as Wichita's first Black and brown doula team. They serve families of color in the greater Wichita area, and I know across the state. She's also on staff with the Kansas Breastfeeding Coalition and has advocated for Black maternal health initiatives, including Senate Bill 42, where she gave testimony encouraging KAAC to gather information on Black maternal deaths in the state of Kansas. I know she did that because I was also in that committee hearing and did some testifying. That's how we first originally got to know each other. So thank you again for coming on. And I did want to touch on your why, right? Your why do you do this work? I know you have 5 children.
I do.
You are a mother. And why did you start down this road? Why did you take this path?
Because when I lost my own daughter, so many people came out of the woodwork and they said, Sapphire, me too. I also was not listened to. I also was treated poorly. And the more I learned about the issue, the more I realized how big of an issue it is, how it's a societal level problem. It's not something that we can change overnight, even though we want to. And I caught the bug and I realized that there's no way I could ever turn my back on the things that I was seeing and pretend that I hadn't seen them. There are things that you just can't unsee and you can't unhear, you can't unlearn. And once I realized how pervasive this issue is within the medical care system in particular, I wanted to change it. And so I jumped in and I've done the best that I could, considering that life happens. Life starts lifing when you think that you have plans. And I'm proud of what we've been able to do because the changes have been needed for a long time, for decades. We've known about these issues in Kansas for the past 30 years, over 30 years, and not much has been done to move the needle. Overall, our rates of death for infants and mothers are declining, but those disparities, that ratio showing that Black and brown mothers and babies are still passing away at much higher rates, that has not changed. People have not been able to get to the root of why that's happening. And we are on to something with our work. We are getting to the root of that and we are making changes. And so my why comes down to the need for change and the hunger to change what I see is broken in our society.
I wanted to thank you for that, and I wanted to put in here to talk about the history and the history of disparities. In getting ready for this broadcast, Sapphire had sent over a YouTube video, and I will put the link. Let me do that now. My intern has gone back to school, and so now I have to do all this on my own. But I will put the link in the comment section right now. referring people to this YouTube video. It's a 10-minute long video, so it's a little long for our half-hour format. But in this video, it goes over 400 years of reproductive control. And I watched it 3 times because I'm like, let me really try to get all this information in. So when we talk about the history of Black and brown women, access to adequate health care, and then back it up to how we have always had access to adequate health care and how that system was changed to where we are now. And when we talk about health disparities. So I wanted to give you an opportunity, if you can try to maybe sum up that video, and then it's in the link. So please go watch the video. But yeah, tell us about that.
Yeah, so that video I actually created as the animator and as somebody who knows the history of this issue. This is something that I know pretty intimately. And I want everybody to know that 100 years ago in this country, almost every baby was caught by a Black or a brown midwife. Medical obstetrics was not a thing yet. And it wasn't until about 100 years ago that the medical establishment realized that if they took control of birth, it would be pretty lucrative. And they've had control ever since, to our detriment. It used to be that Black women in particular could get community-centered care because that midwife was in and of their community. They understood the walk, what it means to be a Black woman in society. And they gave a level of care that isn't offered today. And in 1921, 100 years ago, there was an act that was passed called the Shepherd-Towner Act. And what that did unintentionally was it legislated midwives out of existence and put birth into hospitals, into the hands of physicians. Even though for years, for eons, birth was a woman-centered event. It was something that was attended by an older, skilled woman, an auntie or a grandma, somebody skilled in birth who had had their own children. And when that happened, we saw the disparities skyrocket, and it makes total sense. What Kansas Birth Justice Society is focused on doing is revitalization work. So not just putting a Band-Aid on what we see today, but training Black and brown midwives, revitalizing that as a cultural role. We need those folks back. If we had that level of care, I can guarantee you we would see the disparities end.
That's great. And I know you yourself are a doula.
Yes, I have been a doula for a number of years, and I'm a midwifery student. And
and I wanted to bring this up because I think, these are words that, since it's no longer in our culture, right? It's no longer in our culture to know what these roles are. It's no longer in our culture to have these types of things. Could you do a little education? What's a doula? What's a midwife? What's the differences? How are they united? Okay.
So the main difference is a midwife is a medical care provider. They take care of the mother and baby's medical needs. They track the vitals, things like that. They are trained to recognize when something's going sideways, if somebody needs to be escalated to a higher level of care, for example. Whereas a doula actually works in all settings, hospital and home births, birth center births, everything under the sun, but they're not a medical person. A doula is an advocate, and they're a health educator. And so they're really a subject knowledge expert on birth, but they are hands off as far as medical care goes.
Okay. Yeah, I'm not even sure I knew that. So thank you for that distinction. So you're a doula now, and you're training in midwifery.
Yes.
So where are the programs? Like, does KU have where does one go if you're interested? Where does one go to get this kind of?
It depends on what kind of midwife you want to be. So there are in-hospital midwives, which are certified nurse midwives, which are, they're trained very traditionally with the medical paradigm and that model of care. And then there are out-of-hospital midwives, and they're trained through apprenticeship. And I am training to be an out-of-hospital midwife because I see the value in being able to work outside of systems and the freedom in that. And so that's the main difference between the two. The major problem, and the reason that we don't have very many Black and brown out-of-hospital midwives at this point in this country, is gatekeeping. It's an apprenticeship model of learning. And so each individual apprentice has to have somebody to teach them. And for the past 100 years, the midwives that have existed in this country have been white. And so there has been a massive level of gatekeeping. I live in Wichita, for example, and my preceptor who's teaching me is in Lawrence. And that was the closest that I was able to find a spot for an apprenticeship. And the gatekeeping is so real. But once I am trained, I'm opening that door for everybody in Kansas who wants to be a Black or brown midwife. And there are going to be so many of us that heads will spin.
That'll be fantastic. And I will have you on again so you can tout your program, how people can get in contact with you. Actually, I'll drop it in now because I do have the links to the Kansas Birth Justice Society site, your website.
Thank you.
I'll put that in the comment or in the comments there. So that way you can learn about the program or learn about the organization just in general. If people have questions, they can contact you, and I know you have a contact tab there. So I love that, just telling us what the difference is between a doula and a midwife and why the services are so important. I know right now it has been definitely a hot button issue with the recent proposed change to the Kansas Constitution. That amendment was defeated, the value of them both. And I want you to talk about why that would have such an impact on Black and brown communities. So this is, it is often talked about as if it's a political question. It's so often talked about as a political question, when ultimately this is a healthcare question.
It is.
Ultimately, this is. So please tell us about how that amendment would have impacted Black and brown health and what you see moving forward.
So the impacts would have been profound. And we actually did take action to inform and educate our community on how that would impact us through our political and advocacy wing called Kansas Birth Justice Action, which I believe you have the website for as well. The biggest concern is lack of access to needed health care. So abortion, despite what some people may frame it as, is health care. There are so many of us out here who, without an abortion, without a medically facilitated termination of pregnancy, would not be alive. Black women are more likely to have severe preeclampsia, preterm birth, cardiovascular conditions, all of the things that are medical reasons that carrying a pregnancy to term isn't always the safest thing. And many of us have children at home. And so a lot of times it comes down to the question of, am I going to survive so that I can take care of my existing children here in my home? Or am I going to carry a pregnancy to term and I die and the baby dies? That situation is real. It's not hyperbolic. It is reality for so many Kansans. And Roe was really the floor, not the ceiling for us. When that Supreme Court decision came down, we were already facing less access to abortion. In Kansas, despite what some folks have said, abortion is not publicly funded. It's extremely expensive. And when you're living in a role in society in which you are less likely to have expendable funds for medical care in the first place, it's not as accessible. And so this really was a doomsday scenario. We rushed and informed and did everything that we could to mobilize our community because we knew, according to research, that there would be a 33% jump in the number of Black women who die around the time of childbirth if an abortion ban had been implemented.
Yes. So outside, there was two from the video, and I have the link. So please, everyone, please go watch the video. That point came very clear, that it's an access to healthcare that's going to save lives. That point was super clear. So please, everyone, watch the video. The other thing that jumped out for me from the video was this idea that it really does come somewhat down to control. That if you look over the history of the history of Black women's healthcare, the history of Black childbirth, that it really does a lot center around control and who has the control to make those decisions about our bodies, who has the control to. So if you wanted to talk about that at all as well.
Yeah, it comes down to control. And in this country for the past 400 years, you saw the video and it talks about this much more in depth. But controlling reproduction is the easiest way to control somebody's destiny in life, particularly for women. And the number of children that a woman has impacts her lifelong wage that she may earn. It impacts her ability to access education. It impacts her household income. It impacts all of the things, and going back 100 years, not only was snatching childbirth from communities the most lucrative thing to do, but it also gave societal control. Because when you are in charge of how many babies are born, or you're able to control that, you are also able to dictate the percentage of folks in your community who are Black or brown. It comes down to eugenics. There's a long and just horrible history of eugenics in this country. I won't name specific organizations, but there are organizations that exist today that pushed eugenics as recent as 50 years ago, and it comes down to the very white supremacist idea of white folks should never be outnumbered, that Black and brown people need to be kept under lock and key, under control, and exploited economically, but otherwise kept in line. And so if you watch the video, which I encourage everybody listening to watch, you'll see that the idea of abortion bans come down to white supremacy and control. The midwives who were in this country for centuries, up till 100 years ago, knew how to facilitate abortions. And that's an incredibly powerful skill to have in a community where medically, according to the traditional medical paradigm, where that service was not offered at the time. They knew about cotton root bark. They knew about clary sage. They were root workers. That's what's missed. They were incredibly skilled. And these were things that they were able to do before modern medicine was around.
Yeah. So for a lot, in many communities, again, the video, I'm going to continue to reference the video. Please go watch the video, because they talk about, yes, in the Black communities, there were midwives. In the Hispanic community, there were midwives. In the Native American population, there were midwives, which makes sense. It's one of those things, I think, when we take 3 minutes to think about how many people are on the planet, right? Versus how long the medical field has been the medical field. Obviously, people have been skilled in birthing babies before, the advent of the modern health structure. Yes. So, yes, I want to continue to go back. Please go back and watch the video. Okay, so with your organization, with the Kansas Birth Justice Society, tell us some of the things about what you do, or what are your goals? I can imagine, I don't want to speak for you, but I imagine for a lot of people in this space, August 2nd was just the elephant in everyone's room. Now that we're past August 2nd, and had the outcome that was I am happy for the outcome. Let me just go ahead and say it. Now as you're looking ahead, what are some of the things on your horizon now? What are some of the things that you're working toward? The fight obviously is not over in terms of reproductive justice just because of one vote. So talk to us about the future of your organization.
Yeah, so we have two main parts of our work. The first part is public facing. So that is the Band-Aid for today. We know that there are issues that we can solve today. So we offer all kinds of public facing services in our Wichita Birth Justice Center. And as we have expanded statewide, we are hoping to put one of these centers in all of the major cities in Kansas, because the need is everywhere. So we have lactation services. We have the only Black and brown lactation consultants and students in this area in our clinic here. And so you're able to come and get help with breastfeeding, not just help, but culturally affirming help from somebody who understands, who gets it, who's not going to make you feel uncomfortable. And we also have childbirth education. We have reproductive health education classes. We have parent groups that are specifically for Black and brown families. We have baby and maternity items. We have a community fridge. I won't name every program, but there are 9 active programs that we have running in our office here.
And right now that's in the Wichita area.
Yes.
Okay.
Yes.
And I know you've turned your attention statewide. So do you have any ideas when those services might be coming to other cities or areas?
It's a question of funding. As soon as we have funds in hand, we are going to hit the ground running. Because what we have seen here in Wichita is that the need was bigger than we even thought it was.
Right.
We opened our doors to this center April 9th with seed money from Kansas Health Foundation. Huge thanks to them. And we've served over 700 individuals, different individuals, since April 9th. So we are incredibly
April 9th of what year? Of 20, you said?
This year.
Of 2022?
Yes.
Wow.
Yeah. Yes. That's huge. I think the fact that we are so embedded in our community, people have trust within these four walls, because this is a Black and Brown led organization. This is by us, for us care, and beyond that care that we're offering, we also are looking long term. So when you look big picture, bird's eye view at the marathon ahead of us, we're looking at things like paid family leave, greater representation on things like the Maternal Mortality Review Committee, which I'm part of. Just every level in government where there needs to be change so that we can actually have equity, not just equality, but equity, we are going to fight for. And we're not ever going to stop fighting, because this is, it took 400 years to land where we are today. And I am guessing it's going to take at least a couple decades to get us to a place where we're experiencing equitable health outcomes.
So you're just like talking, you're speaking my language, right? You're speaking my love language. You're speaking the language of community involvement, community empowerment, and this idea of getting involved actively in the boards and commissions. You talked about you were on the maternal health review board, and paying attention to policies that are going on, like everything. It's like,
that's where it's needed. We have to think not just about today, but tomorrow, and in anticipation of what we're going to need and where we can make the biggest changes. And I every day I wake up, I feel like it's a blessing to come up to this office and do this work, because I see the changes happening in real time.
And that's, you said you've served 700 individuals, because I remember I've got two children myself, and when I first child, and she was born in a hospital, and I didn't have a midwife. I knew I was going to have complications going in, because it's a long story. Anyway, but I remember wanting to breastfeed so badly, and just trying to figure out where to get help, where to get that kind of support. And I did luck into the hospital where I was at, did have like a breastfeeding support group. And I met another Black woman there, and we just became fast friends, just like trying to figure out how to do this. And so when you talk about having support and having people around you that look like you, there's just more of a comfort. There's just more of an ease to it, because it was my first child. So I didn't know anything. I'm like, how is this supposed to work? I didn't have I'm an only child, but to have the support there was so integral. And I know in our community, oftentimes there is, if you watch that video, with good reason, there's a lot of distrust in the Black and Brown communities in dealing with health systems. And so to have a community, an organization like yours, where when you go in, you see people who look like us, is so important and so helpful. And I will champion you and try to amplify your message every time I can.
Thank you. I am grateful for this platform to come speak with your audience today. And I want to remind everybody that regardless of what color we are, where we come from in Kansas, we are all equal partners in liberation. And none of us can sit back on our laurels until we get to that day when everything is equitable, where Black and Brown young ladies can grow up and know, with a reasonable doubt, that they're going to be able to have children and live through that experience.
Right.
And they're going to live to old age. That is the vision that we want for Kansas. And together we can do that. We can make it happen. It's not some, future vision. This is something that we can start on today. But it's going to take all of us caring about every other mother and family as if they're our own.
That's it. That's it. Okay. Just everyone needs to play that on repeat. We all need to care about every mother and family as if it's our own. Okay, see, there we go. We're already at 25 minutes. That's why I knew showing that 10-minute clip, I'm like, well, we can't show the 10-minute video. We'll just talk about it. Because I wanted people to hear your heart behind all these things. So in the last couple of minutes, I always talk about voting. You brought up this idea of paying attention and being involved. August 2nd showed that once people really know what's going on, that an informed voter can be a very powerful voter, and we can, in fact, impact change in Kansas. So that was the special election on August 2nd. There's still a general election coming up on November 8th. Okay. There are two more proposed changes to the Kansas Constitution that are going to be on the general election ballot. One of them has to do with legislative veto, and the second one has to do with the elections of sheriffs. So what I'm going to do is I'm going to drop links to Ballotpedia, which is kind of like Wikipedia, but for ballots, into here. And I will, in the coming weeks with Lunch and Learns, we'll come back and we'll revisit all this, but I want to get this information out so people can start looking at it. You can also make sure that you check your registration, make sure that you are registered to vote. Again, I got to make sure I get all my links. See, this is why I need Sierra, my intern. She's awesome. And she went back to school. What can I do?
Magical. We have interns here too, and would not get half the things done if we did.
Because normally I say these things and they magically appear in the chat, but now I have to do all these things. So Sierra, if you're listening at school, you're awesome, and I miss you already. So you can check your registration at ksvotes.org. You can get registered, all those wonderful things. And the last thing I'm going to drop into the chat is the voter network link, because one of the things we know is that relational organizing is the best way. This idea of you have your friend, you tell your friend, hey, are you registered to vote? Hey, do you have a voting plan? Hey, do you know how can I help you make sure that you vote? So all those links are now in the chat. And if not, they will be on the YouTube in the description box. So I'll get it all figured out, because now I have to be a big girl and learn all this technology on my own. Okay, so now is there anything else you would like to say? We just have a couple minutes left here. Is it any last shout outs, any events or anything are you hosting, or just?
We don't have events, but one thing that I did forget to mention is our advocacy wing, Kansas Birth Justice Action. We have a website for that. It's ksbirthjusticeaction.org. And folks can actually get on there and sign up to be a community mobilizer. And so it's that relational mobilization that you just spoke to.
Okay.
And so we want people to sign up so that we can keep them informed on what's coming up, because what happened August 2nd was amazing and miraculous and huge and made national news. But there's more coming down the pipe. Like you said, we can't sit back and say that's good enough. The fight is not over.
Fantastic. So you said it's ksbirthjusticeaction.org?
Yes.
Okay, so I put that in the chat as well, and we'll get that shipped out in the links later. Thank you so much. Thank you so much for coming on. I know it's super short notice. I ran into you over the weekend and was like, hey, do you want to come on my show on Monday? And you're like, sure. So I really appreciate you taking the time to come on here and talk to me. Again, I'm a big fan of your work, and I personally, given my background and my history with childbirth, I am invested in trying to help all of your education efforts and all of your community support efforts moving forward. So we will definitely be in touch.
Thank you, Stacy. It was an honor to talk with all of you folks today, and an honor to be an ally, to fight alongside everybody listening until we do have an equitable society. So
I love it. I love it. Okay. Thanks so much, everybody. I will see you next week. And thank you again, Sapphire.
Thanks.
Bye.